Researchers have found that marijuana has the lowest risk of death and is safer than the commonly used alcohol and tobacco, as well as the rest of the drugs, in many studies. Some of these drugs are like pain relievers, alcohol, cigarettes, tobacco, whatever you could think of. We have found that marijuana has the lowest risk when compared to other drugs, and it's not surprising because previous research has found that marijuana is a substantially safer recreational drug than other commonly used recreational drugs examined in studies. Marijuana doesn't even come close to the lethal risk of alcohol, which researchers found to be potentially more deadly than heroin. Legal regulation of marijuana might be a more reasonable approach than current prohibitions. The CDC reported that there were 1.2 million emergency room visits and 2.7 million physician office visits due to excessive alcohol use. Marijuana only had about 400,000 visits to a hospital in 2015. Marijuana is far safer than alcohol, tobacco, and other legalized substances. Caffeine is also more addictive than marijuana. Yes.
In 2015, the marijuana is still not legal in most states, so if there are already hospital visits, wouldn't it increase if marijuana was legalized?
You don't know that. Because you could put regulations on how many people can use it at a time, how much you can get at a time.
But they haven't done that with alcohol, so you don't know if they would do it with marijuana. Because you're saying alcohol is worse than marijuana. It seems like that's the point you're trying to make. So then, if marijuana is not as bad, more people would be able to get their hands on it.
More people die from sleeping pill overdose and alcohol and tobacco, while marijuana has no known case of death through overdosing. Back to the caffeine, we have found that caffeine, as coffee, soda, anything else like that, it shows much more addiction rates than marijuana. And that's all I have.
Do I just start whenever?
Yeah.
Okay. Well, marijuana and whether it should be legalized in the United States. My answer to that question is no. Marijuana is known to be highly addictive and is considered to be the gateway drug to stronger and more dangerous drugs like cocaine and heroin. I found evidence from the National Institute on Drug Abuse that shows a person who smokes marijuana is 104 times more likely to use stronger drugs rather than someone who has never tried marijuana at all. The mass majority of cocaine users, 99.9%, began first by using a gateway drug like marijuana, alcohol, and cigarettes. A national study was conducted and the evidence showed that children who use marijuana are 85 times more likely to use cocaine than non-marijuana users. Other than marijuana being highly addictive, it's also terrible for your health. Short-term effects are lower reaction time, changes in mood, and difficulty with thinking and problem solving. Long-term effects are critical to your health once they reach a certain point. The physical long-term effects are reduced resistance to illnesses like the common cold or bronchitis, drowsiness, lack of motivation, and the inability to understand things. Because of marijuana's addictive quality, people tend to stay hooked longer, opening up their chances to the long-term effects. Today, marijuana is already the #1 most abused illegal drug, and making it legal will just allow more people to get their hands on it. Making marijuana more accessible by the public will also increase the possibility of children and teens getting hold of this drug. Yeah.
But couldn't you restrict the whole teens and minors getting a hold of it by putting restrictions on it like alcohol and tobacco have right now? Those drugs, as we said, have been more proven to kill more people and have more bad things to it than marijuana, which is illegal. We spend more money by illegalizing marijuana than we do by legalizing alcohol and tobacco. So why are we spending so much money and thinking of how people and minors can like get affected by marijuana when if we make it legal, we can put restrictions on it and stop the whole bad thing about it. When it is illegal,
They have restrictions on alcohol, yet teens are still caught drunk drinking and driving. So restrictions don't always work.
yeah, but when it's illegal, we also have to realize that there's still people using it right now and there are more people dying because there's the whole thing of it's bad, we can still use it, and the whole thrill they get from it being like restricted, and they can still have it because it's still out there even though you're making it illegal. You're just wasting the money and all of that and restricting it when it's not what we do.
But making it more accessible makes it easier to get than it already is. So say it becomes legal, getting it will become easier than it already is. Say, I know people are have it now and there's still people who are stoned and drive, but making it legal will make it easier for those people to reach that drug rather than the obstacles that they have now. If marijuana is legalized, there will be problem in the pharmaceutical department as well. I know medical marijuana, that's one of the hardest topics I found because I agreed with it. But the reason I agreed with it was because medical marijuana is often used for people with cancer and people who have pain like glaucoma patients or HIV/AIDS patients. But I found that only 10% of the people getting medical marijuana are those types of people. The rest, 90%, are patients prescribed with chronic pain, an indefinable term used to cover headaches and minor arthritis, both of which do not need powerful medication. Finally, something we can't afford to lose, our environment. Outdoor marijuana farms pose a threat to our natural resources and wildlife.
Colin.
Okay.